Now, with that background, today we are going to discuss what are the various surgical procedures that are carried out in pancreas. And as we discussed, pancreas is a retroperitoneal organ or extraperitoneal, whichever term you want to use. Of course, there's a difference between what is a retroperitoneal, what is a extraperitoneal. You don't see this organ frequently. You have to make a specific efforts to look for this organ. And obviously, it is surrounded by so many important structures, surrounded by so many important major vessels, that is worth revising anatomy of the pancreas. This is what is anatomy of the pancreas. It's situated in upper abdomen. The classical site is below the stomach, partly covered, surrounded by C-loop of duodenum. Posteriorly runs across the midline, has the inferior vena cava on the right side, abdominal aorta on the left side. The branches of abdominal aorta, like superior mesenteric artery, and behind the head of the pancreas is an important structure called common bile duct, which is parallel to hepatic artery and common bile duct, which drains into second part of the duodenum. This is in brief about the gross anatomy of the pancreas. When we discuss about the landmarks in pancreas, often we say there is a head of the pancreas, there is a neck of the pancreas, there is a body of the pancreas, and there is a tail of the pancreas. Now, what is the dividing line? The portion of pancreas which is to the left of superior mesenteric vessels is called body and tail of the pancreas, and this portion is called the neck of the pancreas, which is situated just in front of superior mesenteric vein, joining with splenic vein, forming the portal vein. The portion to the right of portal vein or the superior mesenteric vein is the head of the pancreas. The one which lies on superior mesenteric vein, splenic vein junction is the neck of the pancreas, and to the left is the body of the pancreas. What is the tail of the pancreas? The tail of the distalmost portion of the pancreas, which is in relation to the hilum of spleen. If this were the spleen, this is what is called tail of the pancreas. So when we talk of various types of resections, you may have excision of head of the pancreas, excision of head of the pancreas with duodenum, common bile duct, distal part of the stomach, is what is called pancreatic or duodenectomy. Of course, there are types of pancreatic or duodenectomy, we'll discuss a little later. what is called distal pancreatectomy. Anything to the left of superior mesenteric vein, splenic vein junction or beginning of the portal vein, excision of this part is called distal pancreatectomy. Portion of pancreas which is in relation to the, or tail of pancreas which is in relation to the spleen, is called excision of tail of the pancreas with or without splenectomy. And there's something called central splenectomy, pancreatectomy. This is you excise a portion of body of the pancreas to the left of portal vein and superior mesenteric vein. This is called central pancreatectomy, and the continuity is restored by ligation and drainage of the remnant of the pancreas. This is in brief about the types of pancreatectomy. Pancreas being a retroperitoneal structure, being surrounded by so many structures, is very richly supplied by arteries and drained by numerous veins, including the splenic vein, the superior mesenteric vein, which joins into the portal vein. The blood supply, the arterial supply of the pancreas comes from the celiac acid, branches of celiac axis, and the branches of superior mesenteric artery. And among the celiac plexus, it is both the splenic artery, the hepatic artery, both supply arteries to the pancreas. The head portion is supplied by gastroduodenal artery, which divides into anterior pancreaticoduodenal artery and posterior pancreaticoduodenal artery, the two branches, and inferior pancreaticoduodenal artery, which divides into anterior and posterior branches. And the body and the tail of the pancreas is supplied by branches of the splenic artery, which are numerous, multiple, and they are anastomosed with each other. And the drainage is into portal vein through the splenic vein and the superior mesenteric vein. It is so richly supplied that any procedure on the pancreas is associated with significant amount of blood loss. The special part of the blood supply is the C loop of the pancreas. This portion derives its blood supply from branches of superior pancreaticoduodenal artery, which divides into anterior branch, and inferior pancreaticoduodenal artery, which divides again into anterior and posterior, supplies both the duodenum and the head of the pancreas. So excision of head of the pancreas, one has to be very careful. You can compromise the blood supply of the duodenum. So excision of just the head of the pancreas, one has to be very careful, preserve this blood supply, otherwise the blood supply to the common bile duct and blood supply to the duodenum gets compromised, and there can be problems postoperatively. With this, the surgical procedures of pancreas, if this was the pancreas, are basically classified into two. One is resectional procedure that we have just discussed, that you excise a part of the pancreas. And when you excise a part of the pancreas,